Absolutely. So,
Hmm.
can I ask you about it is if the stage 4 cancer is curable?
Which one, sorry? Can you ask
Is
me again?
the stage 4 can
Stage
is
4.
the stage 4, yes, is curable?
It's not. Stage 4, I
Okay.
cannot 100% say it's curable. No. You
Okay.
can control it.
How long
Stage 4,
out?
you control it. It is palliative. Once it's crossed beyond the radical, and as I said, even level 3, it's difficult for me to say that I can cure, when it goes into the neck nodes, even though everything is fine, it starts from there, the palliative. I wouldn't guarantee my patient. I would say, yes, we can knock it as much as we can. We can buy you many years, but 100%, I cannot guarantee that you are cured. But having said that, I have seen people 10 years of treatment with that node. Again, the biology, it was a bit nasty, but they're doing well because you biopsy, there are new research, new drugs coming up. You people are living longer. There could be other reasons that take them over rather than cancer. They don't die of cancer, they die of other medical problems. So from that point of view, the cancer didn't kill that person. But having said that, if he had lived longer, it might come. I've seen cancer coming back after 20 years, even for a good one, because down the line, you're exposed to different injury and different insults, along the food or radiation and other things. So cancer can change its behavior. It can come back after 10, 20 years, even though you're cured from the curative. The early breast cancer can
Mm,
relapse later down the years. So to me, the breast cancer, yes, early breast cancer can be cured, but again, 100% for the rest of the life, if you have a breast cancer, you have to follow self-examination. You have to have a low threshold for any symptoms, any new bone pain or loss of appetite or, lumps and bumps anywhere. You cannot, you have to be careful to the end of the life, I'm afraid. Look
so thank
after
you for that.
yourself. Yeah.
Okay.
Yeah.
Sorry.
Have you finished?
And not yet.
Mm.
So for you, how we can how can we manage to treat the both physically and emotionally as a breast cancer patient? How can we manage the side effect of the breast cancer physically and emotionally?
Mm. Again, it depends upon what treatment, what stage of the cancer, what treatment. You need to understand that. And you need to understand the patient as well. How are they physically coping up with the diagnosis and the treatment, and do they have enough support? Are they themselves on their own, or do they have family or friends or any counseling center, contacts? So you should understand both, and then you have to provide good consultation, good time interaction with a treating consultant. And we have breast cancer, as I've said in our front, that the nurse specialist, there is always a group of breast cancer nurse specialists whom they can go to for the physical, emotional support. They can always get in touch. There are counseling for patients with cancer in our setup. Community teams are there for counseling. Psychologists. There is a psychologist for cancer. So we do have these specialities, allied specialities, to support the journey of the breast cancer, both emotionally and personally. Myself, I do. It's, you don't have enough time, but I do touch base the emotional. I do tell them that, you should, how to keep calm, how to face it, how to fight it, how to divert it. Don't think about it, and leave those worries about cancer to me, and then you start to enjoy, live for the day, do something that you're passionate about. So I help them counsel myself, that how important, other therapies, whichever you're passionate about, discover yourself what you want to do. So this kind of discussion, time for this discussion, always helps them cope up. It's just a good complementary holistic approach from the hospital or the primary physician, as well as good links with other allied health specialities, and also making awareness and educating them how to look after them after the treatment or diagnosis, so they're not dropped down just like that. Oh, I finished all my treatment, I'm a bit scared, nobody's there to look after. To give that ongoing support is very important. So I'm going to stop here. unless you wanted more.
Mm. That
Yeah.
was that was great. So
Mm.
um for me as a mother, I have questions. So is breastfeed can reduce the risk of breast cancer?
Yeah, I think scientifically it's proved that you know breast estrogen. We should just give breathing space in the women's hormonal side. Too much of estrogen. Estrogen is the one that you get when you have a regular menstrual cycle, as long as till menopause, 30, 40 years, or 50 years. I can't say 50 years, but yeah, 30, 40 years. You have to have that cycle of estrogen coming up and going off, coming up. So by stopping that cycle, when you breastfeed, you don't have that estrogen there, isn't it? You don't have that cycle there. So it's good. Can you see where I'm coming from? Estrogen is the driver for cancer. And if you give a break for that, a holiday for estrogen, so breast when you feed, you don't get periods, don't you? There is no cycle there, but you do get sometimes later. But what I'm trying to say is that gap, that rest,
Okay.
breathing space. So the cancer irritation target is less, isn't it? So it is good. Yeah.
So I can tell that I am safe in breast cancer now.
But I do not know your background, but I just answered to the question, is breastfeeding good? Yes, it is good from the breast cancer. But I do not know your history. So I can't comment on that. And I don't want to unless this is going public, isn't it?
Okay. Thank you for that. So can we proceed now to the last question?
Mm-hmm.
Okay. How do you approach discussing the possibility of breast reconstructions with breast cancer patient?
I think you have to have a good knowledge about the cancer relapse, about the behavior, and discuss with your surgeon and the oncologist. There are two implications with breast reconstruction. One is, are you out of the risk, high risk cancer? Have you done all your treatments? They won't do, sometimes they do immediate reconstruction because it's just the patient's choice. You discuss with them. Sometimes they wait and give all the treatments, including, is there a role for radiotherapy? That's the important thing. Does radiotherapy and surgery doesn't go very well, that, because radiotherapy causes inflammation and scarring, and the surgeons would avoid that because the healing, the bleeding and the healing with the surgery, with this. So you have to time it. You have to discuss with your surgeon and the oncologist the timing of reconstruction. Is it immediate or is it delayed? And once again, the reconstruction, is the cancer fully well controlled? It's not going to come back and the benefit goes off. So these are the factors that you have to touch base and discussing when you're discussing about the reconstruction.
Okay.
Mm-hmm.
Then what advice would you give on how to best support a loved one going through breast cancer?
I
The
didn't.
advice would you give on how the I mean, what advice would you give on how the best support a loved one going through the breast cancer?
You mean, oh, the breast support? You mean the appliance? Is it the
Yes, the
bras and
advice that
are you talking
yes,
about the breast support, the the
yes,
bra
yes, yes,
fitting and everything? Is that what you're saying?
yes, yes.
Okay. That, soon after the surgery, it could be just a lumpectomy. Still, there is a lack of tissue, there is asymmetry, there is differences how you cope up with that, isn't it? And more so with a mastectomy, where there is total loss of something, it feels empty, and you feel the imbalance and image and everything. There's so much going with it. So we do have, as I said, the breast cancer nurse specialists. They take over the support in my practice, in our practice in NHS. So it comes through the surgical diagnostic side. So when they come to the oncologist, it's already dealt with. So I don't deal with those things because our system is already set up. So what is that is the breast cancer nurse specialist, they have all the criteria and guidelines to direct them, this is the correct size, this is the correct support. And we do have I've seen in lots of shops and good shops where there is a category, there is a session for breast for the breast cancer patients, the size and how to support. There are people who guide, the physiotherapists who could guide what is the right support for them. So we do have a system, but I don't deal with them because it's already dealt before they come to me as an oncologist. Yeah.
Okay.
Okay.
Thank you. Thank you.
Oh,
Thank
thank you.
you.
Fine.
Um,
Hope it was
Thank you,
useful,
Dr.
Kosi.
Porna.
no, I think our student has one last question. I think so. If you
All right.
2 to 3 minutes, it's okay.
Okay, so thank you so much, Doctor, for your research work in the field of, oncology. It has really, rose something in me to go into that field. Thank you so much.
Oh, that's great to hear.
I have one question for you. I think you've already spoken about that. If you can, elaborate briefly on the stages and then the grades of breast cancer, because a lot of people would like to know these, stages and grades of breast cancer.
Stages and grades, is it? Yeah.
Yeah, and then the next follow-up question is, it is known recently there is a research going on of how quantum physics can help heal the body, given the appropriate conditions. So, like in the area of meditation, mindfulness, and etc. So, I don't know whether in your practice you have come across patients with cancer who have been healed. By means of quantum physics. Meditation and all.
Yeah, the complementary. Yeah, absolutely holistic. That's what we call it as holistic. Outside the conventional treatment, isn't it? Yeah. Thank you. You're Anthony, aren't you? So thank you. So I'll do these 3 questions one by one quickly. The stages, of course, there are 4 stages in breast cancer. Stage 1 is localized. It's got tumor, node, and metastasis, TNM. Those are the 3 buzzwords. We need to know the size of the tumor. We need to know the nodes, whether the node is positive, whether it's spread to the lymph nodes or not, how many new lymph nodes. Again, there is N1, N2, N3, depending upon the numbers and the site, in the anatomical sites of the lymph nodes. And there is a metastatic M stage. M0 it's not spread. M1A or M1B. There are, again, these are the TNM staging. Again, T1 to T4, once again, you've got tumor less than 1 centimeter, 1 to 2 centimeters, greater than 2 centimeters, more than 4 and above, involving the skin or involving the chest wall. You got inflammatory breast cancer. So depending upon, then you got 4A, 4B, 4C in the T. So it is quite in-depth, detailed staging for breast cancer, to be honest. So these are the TNM, and then based on the different combinations and permutations, you stage 1, 2, 3, 4. Stage 1, stage 2, stage 4. So stage 1 is T1 N0 M0 or T2 N0 M0, where there is not spread to the lymph nodes, but it is 1 to 2 centimeters. Are you with me? Yeah. So that's stage 1. That means stage 1 you can operate. You don't need any other upfront treatment. Having said that, it's also the biology, the ER, PR, HER2 status. It is multi-modality to make a decision, even for stage 1. If it is 10 centimeters, so 1 centimeter and above, but it's triple negative and grade 3, the surgeon would ask, can you give some chemotherapy? Because it's a behavior, it's a naughty one. So can you mop up everything, and then I'll do surgery. So the staging, the biology, all the receptors, and the grade. If it is grade 3 or grade 2, so there are 3 grades. So 1, 2, and 3. 1 is a slow growing, and the grade 2 is intermediate, and the grade 3 is the fast growing of the cancer cells. How it multiplies quickly. So that's the grade. So if it is a grade 1, T1, N0, M0, 10 millimeters, 1 centimeter, ER positive, PR positive, HER2 negative. This is the best good one I wanted to have. If I want to have a breast cancer, this is what I want to have.
Actually, when I was learning this stuff, it was quite difficult. But I think you find it very easy to explain these stuff. And thank you so much. Thank you so much.
Okay, thank you. And I think it's important, and everybody's busy in their clinical work. When you go for a consultation, there's so much to talk about these things. And even for one thing, there's so many things to talk about. So you don't find time to talk about the mindfulness and other things, the complementary therapy. But my practice, it's my own, my personal. I always feel that, if you want to have a successful, long-term positive outcome, conventional treatment alone, it won't work. You need to prepare everybody to face it positive. You should, any stress hormone, anything stress will affect your own immune system. Everybody has your own innate immunity to fight the cancer or fight any foreign bodies that comes to you. Your body can fight it out. So you need to empower your own immune system by staying positive, by doing what you like to do, by stop worrying. And this is very important. So you need to keep stressing, because your mind always goes back to that. It's easy to fall back, isn't it? You need to have that positive attitude. So being a musician myself, it's helping me to see. And I used to tell my patients, I have my own charity work. This is something I started. We have a charity card. I tell my patients, when you're on chemotherapy, radiotherapy, do something, handwork, or do something and bring it on and give it to others. By giving to others, you will feel good. The karma comes back. If you do positive, the positive comes back to you. So yeah, so do that. And then what I'm collecting all this money to try and build a holistic platform in my center. I mean, and I can do that locally, so that's what I'm doing. And I also provide some nice music to them to to link in, to have that rapport and to get that cleansing chatter of the mind away. It is very important. And you could see that in the long run, people do say that, yeah, I feel good. That's good that you're doing that. I do know that somebody is looking after me all the time. That support, that rapport and support is very important, because this is a chronic disease. It's going to be there for the rest of your life, but this is important, that confidence, that rapport, that you are always there and somebody is there for you whenever needed. And that relationship is very important for a long run. So I'm going to go. I'm so sorry. Thank you so much, Kosi. I have to go. It's already 12 o'clock. Is that okay?
Thank you so much for your time.
So best wishes to all of you. And I hope you all have a lovely, healthy life journey. Thank you.
Thank you so
Bye.
Thank you
much,
so
Dr.
much.
Aparna.
Bye. 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 And
Bye.
good luck, Anthony, for your medical career.